A strong healthcare system is the backbone of a country's social and economic stability and security. And yet, climate change is impacting our region's ability to prevent, detect, and respond rapidly to health emergencies. That is why developing climate-resilient health systems is the best defense. It presents an entry point to implement a health in all risk policy approach and an opportunity to work more closely with other sectors such as water, sanitation and nutrition, and partners such as the meteorological services to understand, monitor, and manage risk. Together, we can build a healthier, safer, and more sustainable future for all. The Caribbean Community Climate Change Center and the governments of St. Lucia, Belize, Haiti, Jamaica, the Bahamas, and Grenada have commenced the development of the health chapters in the National Adaptation Plan, or HNAP, to integrate climate change adaptation planning in the health sector.
When you're dealing with planning for health and building resilience within that sector, you're looking at the impact of climate change on the human being and the human being's response to the variability in the climate, rising temperatures, rising sea levels, extreme weather events, the vulnerability of the population as it relates to, for instance, the existence and prevalence of other diseases, and of course, the health system's capacity to provide access to healthcare services to the public.
Development of the HNAP called for 5 major steps: a SWOT analysis, framing and scoping for the vulnerability and adaptation assessment, a capacity assessment of the country's health system, a vulnerability and adaptation sensitivity analysis, and a comprehensive climate impact assessment.
What do we mean by vulnerability and adaptive capacity? When you look at vulnerability, you look at the exposure of the health systems. So, for instance, where your health service providers are located, if they are located in flood-prone areas, areas that have limited capacity or prone to landslides, and you understand the topography issues that St. Lucia experiences as well, and also how our population is settled within this area. And we have a lot of coastline settlements, areas prone to flooding. And that exposes or increases the vulnerability aspect of your population.
In the development of the HNAP, several important documents are reviewed to determine a country's capacity to adapt to climate change, such as policies related to adaptation, land use or physical planning, infrastructure maintenance, water, sanitation and waste management, workforce or human resource, and energy.
One of the major challenges we had was access to high-quality data. For the development of the National Adaptation Plan, we needed to access data spanning 30 years, 3 decades, and not just long series of data, but what we call short series data, where we would get data on a daily basis covering the monthly patterns. And there were huge gaps, not so much in the weather or climate data, but a lot with morbidity and mortality.
The assessment revealed several climate-sensitive health outcomes which would be detailed in the completed health chapter of the National Adaptation Plan, or HNAP. Through the European Union CARIFORUM Strengthening Climate Resilient Health Systems Project, between 8 to 10 countries will receive funding for the preparation of Health National Adaptation Plans. These plans will empower Caribbean countries to be better positioned to bolster their health systems.